An 82-year-old woman is hospitalized in a busy tertiary care hospital due to fever and shortness of breath. The patient has a history of chronic obstructive pulmonary disease. She is diagnosed with pneumonia and started on empiric antibiotic therapy overnight by the admitting physician. After several days of treatment, the patient's condition deteriorates, and she is transferred to the intensive care unit. Sputum cultures were obtained on admission, but the results were not checked by the daytime team, resulting in a delay in initiating more specific antibiotic treatment. The question is, which of the following interventions would be most effective to prevent this type of medical error? If you are one of the smartest people on earth, type the correct choice in the comment box below. A. Decrease the required patient caseload for physicians. B. Increase frequency of team meetings to discuss critically ill patients. C. Obtain infectious disease consultation. D. Require more detailed sign-out notes. E. Use standardized patient handoffs. I am guessing you did not get the answer right. The correct choice is E, which is use standardized patient handoffs. In the hospital setting, multiple providers will assume responsibility for a patient's care at different times of the day, which can result in discontinuity of care. As a result, patients are at higher risk of adverse outcomes when providers do not communicate well during transitions. The process of transferring responsibility for medical care is referred to as a patient handoff, with sign-out referring to the process of transmitting information about the patient and needed follow-up care. Oversights and communication failures during the sign-out and handoff process have been linked to adverse events in a range of hospital settings. Omission of key information during handoffs can result in medication errors, avoidable escalations in care like transfer to the intensive care unit, redundancies in care, and delays in diagnosis or treatment. Standardized handoffs that include specified key elements. Example, a systematic procedure for sign-out. Checklists of tasks that need to be completed have been shown to significantly reduce preventable adverse events. Now let's see why you were wrong. Choices A and B cannot be an answer because reducing patient caseloads and increasing the frequency of team meetings to discuss critically ill patients can both provide more time for physicians to communicate patient care information. However, these interventions would not ensure that critical information is transmitted consistently between providers. Choice C cannot be an answer because consulting an infectious disease specialist would help ensure correct antibiotic treatment and could be appropriate in this patient depending on the clinical scenario and/or culture results. However, this intervention is not cost-effective for every patient and therefore would not be the most effective intervention. Choice D cannot be an answer because requiring more detailed sign-out notes provides more information on each patient but decreases efficiency and increases the probability that important details will be overlooked. Applying a systematic organization method to sign out notes is a more effective strategy to ensure that essential tasks are not neglected. If you already knew the answer, or at least now know the correct one, click the like button.